I'd like to discuss now about choosing a particular kind of t-test. There are three kinds of t-tests that you can carry out to do comparisons. The first one is where you're comparing a sample to a standard. So the example here, we have a new drug was assessed for its effect on blood pressure, and we know what the comparison value is. It's the value of the blood pressure in the population as a whole, which is 120 millimeters of mercury. So we're basically comparing this distribution against 120 millimeters of mercury. In that case, your data will look like this, with just one single set of values in it. Sometimes it's possible to actually use a person as their own control. So here we have different patients, and we measured the blood pressure on a placebo, and then we actually gave them a drug. So we've got two measurements for the same individual. One for the placebo or the control, and one for the drug or your treatment. And we can generate a difference between those. So if you're doing a two-sample t-test for related samples, sometimes called a paired t-test, your data will look like this. Typically there'll be some kind of patient identifier, but you'd always have two columns of data that were evenly matched. We've actually got two values being recorded on the same individual. The third kind of t-test is where you've actually got a drug or a treatment population and a separate placebo or control population. And in that case, your data is going to look something like this, where you've actually got two separate groups, and they're not necessarily opposite each other across the spreadsheet.